Diabetes has a very significant impact on a person's health. Primarily, it can result in increased risk for heart attacks and stroke, and also it can result in blindness and kidney problems. The emphasis for our pre-diabetics is on prevention and helping them avoid the onset of full-blown diabetes.
I had been told by my physician that I was pre-diabetic. My A1C level was 5.8, and I was right on the cusp of becoming diabetic. My doctor had told me I really needed to consider some lifestyle changes.
The Diabetes Prevention Program at the Lifespan Community Health Institute is a year-long program that focuses on lifestyle changes for healthy eating, physical activity, communication, better sleep, lifestyle changes that will reduce your risk for type 2 diabetes.
Sometimes they come because the doctor said, and sometimes they learn about the program.
Regular exercise, that includes 30 minutes of aerobic exercise, 5 days a week is a minimum.
You can do 15 and 15, or even you can do 10, 10, and 10.
And also modifying your diet to be more plant-based and less saturated fats.
We got recipes on how to make, and a demonstration on how to make cauliflower pizza.
Because it's a year-long program, the changes are going to be very slow and gradual, and that's what makes this program work. So by making those small changes, it's more sustainable. So it could be, my goal this week is just to research gyms. That is a great goal. And then within a month, they might be going to the gym once a week.
I tell them, this will be a beautiful journey. Now we don't know each other, but at the end, we will be as a family.
I really am a social person, so knowing that I wasn't alone doing this really helped me a lot.
The group dynamic is very important because everyone in the group is facing a similar challenge and trying to reach a similar goal.
So I just sort of felt this incredible sense of support that you don't feel when you try to do something on your own.
The Diabetes Prevention Program has been offered virtually, and I find that it's been pretty successful. I wasn't sure how it was going to work out.
Getting enough sleep can help you prevent or delay type 2 diabetes.
But it's worked out pretty well.
It was so wonderful for me because I would have had to drive to Providence 40 minutes from my home to meet with everyone, and now with technology and Zoom available, it made it possible through the pandemic for me to achieve my goals while being at home.
We've had participants that have taken the classes from their kids' baseball game or baseball practice. Someone was in Florida, so versus having to miss it, they actually joined, which is nice.
So now that I'm almost done with the program, I have an A1C level of 5.5, and I'm really excited that I've been able to move myself out of the pre-diabetic range, and I'm not really on the cusp of diabetes any longer. I have a much healthier lifestyle, and I'm really following through with things and more determined now than before.
Our approach to patients that have already been diagnosed with diabetes is very intense. There are several screening tests we regularly check, and some patients are referred to specialty care.
As a certified diabetes educator, I work one-on-one with patients who have diabetes to create a highly individualized and unique diabetes therapy management for that particular individual. I go over 3 very important parts that each play a critical role in diabetes management. One is diet, and making sure that we are eating certain foods in moderation, avoiding high carbohydrate foods or foods that are high in refined sugars or processed foods, and increasing our intake of vegetables and more plant-based foods. We also talk about physical activity. It's important to stay moving to burn off all that extra sugar that we might be carrying. And then lastly, medications, which may or may not play a role with a patient depending on where they are on their journey for diabetes. What works for one patient may not work for another patient, and what may work for one patient on day 1 may not work for that same patient months or years later. So that's why it's critical for patients to continue to follow up with their healthcare team to make sure that the diabetes does continue to stay in control.
I've been in practice for about 25 years, and if I was going to give a message to folks that have either pre-diabetes or diabetes, is to let them know that they're at risk of dying from a heart attack. So when I become concerned about the patient's diabetes, my primary goal is to avoid that terrible outcome. So it's really important to follow the guidelines that include significant lifestyle modifications as a common sense approach to this scourge that we have in our country.